In this video, I want to give you a general overview on vitamins, which means fat and water-soluble vitamins, and minerals, as well as B vitamins, and tell you why they are important. Women in the childbearing age, especially if a child is welcome in your family, are recommended to take folic acid. Since folic acid can cover up a B12 deficiency, take some B12 once in a while. It is also a good habit to have some folic acid or B12 on your counter or bathroom closet and take it from time to time. But don't go nuts about it, especially if you have a balanced diet. In our home we eat quite healthy too, and we have 2 multivitamins we found out for ourselves that work the best for us. They are food-based. The first one is from Rainbow Light, Advanced Nutritional System, and the other one is from Source Naturals, and it's called Wellness Formula. But we just take them as a little supplement. For example, the Advanced Nutritional System, they want you to take 6 a day, and we just, when it really comes up, we take 1, or usually we just share 1. Same with the Wellness Formula, I take 1 a day, that's it. So when you're pregnant or you plan to have a baby, it's important that you know what is good for your body, especially with our Western diet. We lack in a lot of nutrients, and I understand any concerns about your health and the health of your future baby. And it says also about you that you're a responsible person and that you take care of that new life, and that your child is more important to you than your own pleasures, like lifestyle, food, habits, and so on. But don't go crazy. Just take it as a little help. Particularly during the first trimester, an expectant mother needs to avoid foods and drinks that might cause birth defects. Researcher Margie Prophet showed that a little pregnancy illness could help the mother to know what food and drink to avoid. In fact, nausea in the first trimester is associated with improved pregnancy outcomes. Although excessive pregnancy illness can be dangerous, counseling and other techniques to try to prevent any such illness are counterproductive. Landon Smith, MD, wrote, "A lack of vitamin C and magnesium can cause the nausea of early pregnancy. If a woman is not getting enough of the B vitamins in that first trimester, notably B6, her baby may not get the right building blocks to make a well-developed dental arch and palate. Take B6, zinc, vitamin K, and ginger root. Also snack every 2 to 3 hours, including 4 a.m., to keep the blood sugar from falling too low. The metabolism of the pregnant woman is so great that if she does not eat for 8 hours, she has used up her glycogen stores and starts to burn fat for fuel, leading to acidosis. Glycogen is a partially soluble, starch-like substance produced in animal tissues, especially liver and muscles, and changed into a simple sugar as the body needs it. Fatty acids then metabolize to acetone and acetoacetic acid, causing nausea. To counter the acidosis, the body vomits stomach acid to balance the pH, the acid-alkaline status. A mother who properly nourishes herself with plenty of the vitamins and minerals naturally occurring in fresh raw foods will deliver a baby strong in immune response, free of infection, and if she breastfeeds, also free of colic. An easy, relatively painless birth is an extra bonus, and she is far less apt to suffer from postpartum depression, tooth degeneration, unreliable vision, and other assorted symptoms that have been wrongly ascribed to the psychological problems. However, a vegan diet is not advisable, particularly during pregnancy and lactation. It could risk neurological and intellectual damage to the baby from deficiency of vitamin B12. No food of plant origin contains any of that vitamin, and so a B12 supplement is advisable. Serum measurement of B12 is grossly inaccurate. At least homocysteine, HC, and methylmalonic acid should be tested. Vitamin B6 level may be low as well. Elevated HC can be serious for the baby as well as mother. It increases the risk of catastrophic clotting and of arterial damage. This can increase risk not only of adult heart attack, stroke, arthritis, Alzheimer's disease, and cancer, but also Down syndrome. We caution against extremely low-fat or pure vegetarian diets at all times, as well as during pregnancy. Not only vitamin B12, but also DHA and EPA were missing from the diet of vegetarians and in their plasma and cord artery phospholipids. Dietary analysis of the food eaten by a group of vegetarians and vegans found they were consuming well above the RDAs of various vitamins, but among minerals, zinc came in at 98% of the RDA and selenium at a desperately low 46% of its non-too-high RDA. Pregnancy requires twice as much protein as other times. The edema that precedes dangerous eclampsia is due to low protein diet. Preeclampsia can be made less likely by ingesting adequate vitamin C and E. Low protein will prevent formation of important brain cells. This can never be made up later. In another comparison, protein deprivation during pregnancy and in the baby's first 6 months led to children with IQs at the age 4, all of 16 points below the average of those born to women on more normal diets. Fat-soluble vitamins, which can accumulate in the liver, must be used but with care. Vitamin A is essential to an embryo to develop normally, but too much, especially before the 7th week of gestation, can cause birth defects. It is easy to get 5,000 international units IU of vitamin A in multivitamins. The threshold for defects seems to be 10,000 international units per day, particularly before the 7th week. Vitamin D2 is extremely important, but can be overdosed. Natural vitamin E is hard to overdo as part of a balanced supplements program. Pregnancy requires extra vitamins and minerals because of accelerated urinary losses. Specific deficiencies often include magnesium, potassium, chromium, and vitamin B6. Particularly during pregnancy and breastfeeding, the mother should supplement her diet with individually appropriate amounts of ascorbic acid, vitamin C, and bioflavonoids, or, far better, vitamin C complex. The natural forms are far better than bioflavonoid tablets. Carefully selected vitamin supplements are perfectly safe during pregnancy, wrote leading orthomolecular psychiatrist Abram Hoffer. Quote, "The results are clear. I cannot recall in the past 40 years a single female patient of mine on vitamins giving birth to a child with congenital defect. Their doctors told my patients that they must stop all their vitamins while pregnant. They looked upon vitamins as toxic drugs." Joel Vela wrote that many birth defects result from allopathic medical doctors giving vitamin and mineral food supplements Only after the patient is told she is pregnant, the embryo has become a fully formed human at 90 days of gestational age. The brain, spinal cord, and heart form in the first 28 days of pregnancy, and so all the prenatal vitamins and minerals taken after that critical period will not correct any birth defects that already exist. Robert S. Atkins, MD, says, long before you get pregnant, you need to take a 5 mg daily dose of folic acid. This is a therapeutic amount, so ask your obstetrician for a prescription. Insufficient folate, which is associated with high homocysteine, also increases risk of miscarriage, other placenta-mediated disorders, and Down syndrome. Supplementing the 3 B vitamins, including B12 and B6, and betaine, also lowers the risk of megaloblastic anemia. SID is risky cervical dysplasia, occlusive vascular disease related to homocysteine, colorectal, and other cancers, as well as Down syndrome. Folate deficiency, the most common vitamin deficiency, may increase SIDS risk by promoting fetal growth retardation. That deficiency has now been linked to the risk of leukemia. It makes Down syndrome more likely. Zinc also plays an important part. Theo Scholl, PhD, evaluated 818 pregnant women. He found that those with low zinc intake had about twice the risk of having SIDS susceptible low-weight birth infants. Zinc deficiency contributes to defects in learning and mental ability. More than 200 zinc-dependent enzymes participate in the body's main biochemical pathways. It is a required component of both DNH and RNH polymerases. Polymerases are enzymes that promote necessary reaction of giant molecules known as polymers. Zinc participates in many hormonal activities, including thymic hormone, insulin, growth hormone, and sex hormones. It is essential for normal fetal brain development, especially hippocampal function. The hippocampus is a part of the brain that handles memory and learning. Baby boys require more zinc than girls to adequately nourish the growth and development of their testicles and prostate, and ultimately to make viable sperm. Zinc is known for its antiviral, antibacterial, antifungal, and anti-cancer properties. Zinc is also required for metabolism, digestive breakdown, and use of other nutrients that the body's detoxification system depends on. On calcium, insufficient calcium is associated with preeclampsia. Calcium requirements double during pregnancy, and the majority of women, pregnant or not, do not ingest enough calcium. There is an antagonistic competition between calcium and zinc, in which elemental calcium is the inhibiting factor, and it is also best to take zinc separately from calcium, rather than together in a single multivitamin or mineral supplement. So these were some of the main and more common recommendations on vitamins, B vitamins, and minerals. Next time I would like to make a video on fats, what differences there are in fats, and our thyroid. I wish you all a good week, and see ya!